Yes, good morning everybody. According to the competency based, today's class is about the pectoral region. The competency number is 9.1. So this is where you cut across pectoral region. Now let's see what are the objectives of the class. At the end of the class or the end of the lecture, all the students who are hearing should able to identify and describe the muscles of the pectoral region. Physically, yes, identification is at this point it is difficult, but yes, by seeing your manuals or Snell's, I think you can identify by seeing there in the diagrams. Yes, description. Yes, when we are studying about the muscles, what you have to know is what is the origin of the muscle, what is the insertion, action, and nerve supply. If so, if there is any clinical related to it, that is to be needed to be known. So, at the end of this lecture, all the students should able to describe the muscle of the pectoral region along with in the book identify. Yes, now coming to the learning objectives. The class in it includes the learning objectives such as introduction, surface anatomy, that is surface landmarks, superficial fascia, deep fascia, and the muscles of the pectoral region. So, when you are in the introduction of the pectoral region, how would you like to means pectoral region as such? If you are saying we will study today pectoral region, the first year student definitely he doesn't know what is pectoral, and we are saying the region. Yes, at what region this pectoral is present. So now coming to the introduction, the pectoral region is a region which is present situation in the front of the chest. So in the front of the chest, this region is called as a pectoral region. It is called so because the muscle which is present here are pectoralis major and minor muscles are present. Because of the presence of these muscles, the region here is called as a pectoral region. Next, what is this pectoral region is helpful for? It consists of the structure which connects the upper limb to the anterolateral chest wall. So we have started our classes, the class of the upper limb. So in the upper limb, if you ask why you are seeing in the upper limb, because upper limb for we think it is from here at this part it is the upper limb. Why you are telling the region here which is at the chest, in front of the chest, we are saying there is a pectoral region. Why in the upper limb this is included? It is included because the pectoral region is a region which connects the chest wall, means the medial wall of the top of your chest wall to the top of the upper limb. So when you are seeing it, it is a connection between the upper limb to the top of the chest wall. So because of this, we are included the pectoral region in the upper limb. So only why pectoral region is said? Yes, it connects upper limb to the anterolateral chest wall. It is connecting the upper limb to the anterolateral chest wall. The link which is connecting the upper limb to the anterolateral chest wall is the pectoral muscles which are present. So because of this part, this region is called as pectoral region, and because of this connection which is connecting the upper limb to the chest wall, it is included in this section, in this competency of the upper limb. Yes. Now, in this region, other than the muscles, what are present? Additionally, in this region, in the pectoral region, there is a modified sweat gland is present, which is called as mammary gland. So, pectoral region not only consists of the muscles, it also consists of a modified sweat gland, which is called as the mammary gland, which has been dealt very clearly in the earlier class. So, in this today's class, we will be only studying the pectoral region excluding mammary gland, because I will not be telling the mammary gland which has already been discussed. It is beneath the mammary gland what are the structures which are present. Let's see it. Yes. To know the pectoral region, there are some things which are called as surface landmarks. Because there is one more thing in this competency which is added, which is called as surface anatomy. This is helpful for identification of the dossier. It acts as a landmark, or it acts for the identification for any of the organ, or it is helpful for the relations. So for this reason we have to know the landmarks. So this is called as surface anatomy. So coming here, the landmarks of the pectoral region includes clavicle, jugular notch, sternal angle, epigastric fossa, nipple, midclavicular and mid-axillary line. So let's see these surface landmarks, the landmarks which are in related to the skin. So because as it is related to the skin, these are called as surface landmarks. So this is the clavicle. I think you knew it. It is the only horizontal bone which is present in our body. So this is the clavicle. Here you get to know the jugular notch or the sternal notch. So this is that of the sternal notch. Next is the sternal angle. So where the second rib will be attached. So this is a sternal angle. There is a fossa here which will be called as epigastric fossa. This is called as that of the nipple. So these are the surface landmarks of the pectoral region. If you ask why you are telling the surface landmarks at in the pectoral part, the surface landmark is a necessity because if you want to identify the pectoral region, as such, one thing what we have said is the pectoral region is one which connects the upper limb to the anterolateral chest wall. Yes, because of this it is present, we call it. But when we are saying where the pectoral region, if somebody asks a landmark, show the pectoral region, then where you will be locating the pectoral region. For this sake, you have to know the landmarks. So the landmarks of these include the clavicle, sternal angle, epigastric fossa and the nipple. Around this thing you can say yes. Beside this, beside clavicle, below the clavicle, at the nipple or beside the sternal angle, yes, the region which is present is called as pectoral region. So this is the surface landmark is necessary to identify or locate any of that of your organ or the structure or to tell any of that of the relations. So in this, for the pectoral region, the surface landmarks include jugular notch, clavicle, sternal angle, sternum, body of the sternum, xiphisternal point, epigastric fossa. There is a line which is called as midclavicular line. So these are all which forms as that of the surface landmarks for the pectoral region. And here you are seeing some fold. This fold is called as anterior axillary fold. This is called as posterior axillary fold. This is the medial wall of the axilla. When you are seeing the boundaries of the axilla, the concavity of the axilla is formed by the ligament which is called a suspensory ligament of the axilla. Later when you are studying, but I want to show you at this point, when you are going in the class, I think you do remember it, because for that sake in the surface anatomy only I am telling it. Yes, this is the axilla. Yes, it is the space which is present between the upper part of of your humerus and the medial wall. So this is the anterior axillary fold, posterior axillary fold, medial wall, and this is the lateral wall. So yes, these are the surface landmarks of the pectoral region. Next, so we have started the class. So I told this class includes introduction. After the introduction, it is surface landmarks. After surface, it is superficial fascia, deep fascia, along with that of the muscles. That is the muscles of the pectoral region. Let's see in the superficial fascia what is present. First, in the superficial fascia, what the superficial fascia consists of? The superficial fascia consists of, this is a superficial fascia of the pectoral region. I think we can see it. There is a fat which is present. The fat which is present in the superficial fascia is a moderate amount of fat is present. The superficial fascia consists of moderate amount of fat along with the modified sweat gland which is called as mammary gland and some septa which is called as fibrous septa. So when we call the superficial fascia is made up of the moderate amount of fat with it within its content there is a gland which is modified sweat gland is present. When we see the contents of the superficial fascia along with the modified sweat gland, mammary gland, the other things that come here are cutaneous nerves, cutaneous vessel, the muscle, platysma muscle, along with the modified sweat gland which is called as the breast or the mammary gland. So, this is the content in the superficial fascia. One thing you need to observe here is the mammary gland is a modified sweat gland which is present in the superficial fascia in the pectoral region. So, in the superficial fascia only you are getting to see the mammary gland. Yes, let's see the contents in detail. First, coming to the top, the nerves. Nerves at the pectoral region which are present in the superficial fascia are the cutaneous nerves. So, which are supplying in the pectoral region are, so these are the branches of supraclavicular nerves and the ventral rami of intercostal nerves. So, the nerves which are supplying the pectoral region are the cutaneous nerves are the branches of supraclavicular nerves and the intercostal nerves, the ventral rami of the intercostal nerves which supply cutaneous nerve supply of the pectoral regions. So when we see it, the upper part of the up to the second costal cartilage, the cutaneous nerve supply of the pectoral region is supplied by supraclavicular nerves. It is the supraclavicular nerves are three, that is medial, intermediate and lateral. So medial, intermediate and lateral, these are the three supraclavicular nerves which supply the cutaneous nerve supply up to the second costal cartilage. Means up to the second rib it is supplied by medial, intermediate and lateral. Below this it is supplied by medially it is supplied by anterior cutaneous nerves of from T2 to T6 segments and laterally it is supplied by lateral cutaneous nerves from T3 to T6. So this is the cutaneous nerve supply of the pectoral region, means up to the second intercostal space it is supplied by supraclavicular nerves. Below the second intercostal space or the second rib, it is supplied medially by the anterior intercutaneous nerves. Laterally, it is supplied by lateral cutaneous nerves from T3 to T6. So, if we see it, the branches of cervical plexus. So, what we are saying as supraclavicular nerves that we have seen, which consists of medial, intermediate and lateral. These are the branches of cervical plexus C3, C4. So these get medial, intermediate and lateral which supply up to the top of the second rib, and even to the upper half of the deltoid part. So upper half of the deltoid along with that of the up to the second rib, it is supplied by that of the C3, C4 supraclavicular nerves respectively medial, intermediate and lateral. Below it means from second to the sixth intercostal nerves, it is supplied by means of anterior and lateral. Anteriorly, what we are seeing is anterior cutaneous nerves. Laterally, it is supplied by lateral cutaneous nerves from T3 to T6. There is one more nerve which is called as intercostobrachial nerve, which is T2, from the T2 intercostal. It supplies to the skin of the floor of the axilla and the medial half of the medial side of the arm. So medial side of the arm is supplied by T2, that is intercostobrachial nerve. So intercostobrachial nerve is supplied in the medial side of the medial half part of the arm, or the armpit dome of the arm is supplied by intercostobrachial nerve. When we see the cervical plexus which is supplying C3, C4 is supplying the upper part up to the second. Below it is supplied by means of, when you are seeing it here, it is supplied by T2, T6, and here it is 3 T2, T6. Okay, here it is supplied. If you see here, C3, C4 is supplying to the upper part. What has happened to C5, C6? Because cervical plexus, if you see it, it is formed by C5, C6, C7, C8. They are forming the cervical plexus. But when you see in the upper limb, means at the pectoral region, up to the second intercostal space, it is supplied by C3, C4. When you see below, what we are seeing is, it is supplied by means of the top here T2. T2 to T6 segments, it is supplied. What is happening for that object? Remaining cervical means C5, C6, C7, C8. So, this is called as pulled away. The area supplied by spinal nerves C3 and C4, they directly meet with the area supplied by T2 and T3. This is because of the fact that is intervening nerves. Between these, there are intervening nerves. Means, see, after C4, it is C5, C6, C7, and C8. And T10, T1, they have been pulled away. So, all C5, C6, C7 and C8 are pulled away to supply to that of the upper limb. So, if you see it, C3 and C4, they are supplying up to the second intercostal space. Below, it is supplied from T2 to T6. What is happening for C5, C6, C7, C8 and T1? These nerves, the intervening nerves are pulled away to supply to the top, the whole of the upper limb, preaxial and the postaxial. There will be supply of the top, the cutaneous nerves of C5, C6, C7, C8 and T1. These are the cutaneous nerves which are supplying the top, the upper limb. So, after the cutaneous nerves, the one more content in the superficial fascia is cutaneous vessels. These vessels follow the nerves. Means, if they are in the pectoral region, medially it is supplied by anterior intercutaneous nerve. Along with that, there is a vessel will be present. Same way, laterally it is supplied by lateral cutaneous nerve. Along with that, there will be a vessel. So, always the cutaneous nerves, they are followed by means of the vessels. But these vessels are very small because they are supplying to the skin. They are very small. The anterior cutaneous nerve is accompanied by perforating branches of internal thoracic artery. So, here the anterior cutaneous nerve, already we have seen the cutaneous nerve. The cutaneous nerve which is supplying medially was the anterior cutaneous nerve. It is accompanied by internal thoracic artery. The perforating branches of internal thoracic artery are the cutaneous supply or the cutaneous vascular supply for medial part of the pectoral region. The lateral part of the pectoral region, which is accompanied by lateral cutaneous nerves. Here, the artery here which is present is along with lateral thoracic artery, there is also posterior intercostal arteries. So, lateral cutaneous nerves are accompanied by posterior intercostal arteries. So, cutaneous vessels which are supplying the pectoral region is, one is and perforating branches of internal thoracic artery, one more is posterior intercostal arteries. The perforating branches of internal thoracic artery is accompanied by anterior cutaneous nerve. The lateral cutaneous nerve is accompanied by posterior intercostal arteries. The thing to be understood here is the intercostal thoracic arteries, that is second, third and fourth, which are the perforating branches, are large in case of females because they supply for the mammary gland. Because of this, normally when we are seeing, the cutaneous vessels are very small, but when we see in the females, they are thick and they are very broader in sense. So because as they are supplying to the mammary gland, the second, third and fourth perforating branches are large in case, they are the large in cases of the females. Yes. The another content in the superficial fascia after the cutaneous vessels and the nerves is the muscle, that is platysma. Platysma is a muscle. It is actually the muscle of the face, facial muscles. All the facial muscles are also present subcutaneously only. So among that, the one muscle which is coming extending from the neck to a part of the pectoral region up to the second intercostal space, we can say, is a platysma muscle. It is a thin broad sheet of subcutaneous muscle which is present, and the nerve, because it is a facial muscle, it comes under the face. In the facial muscles will be in the head and neck, will be studying very deeply, but in the pectoral region, when you see in the superficial fascia, after we remove skin, then you see the superficial fascia. In the superficial fascia only, what we get to see is, when we are doing the dissection part, we come across to see the cutaneous nerves. Along with the nerves which are accompanied, you come to see the vessels. Along with the vessel, when you are stripping out, what you can see, you will be getting, when you are at the upper part of the neck region, you come across the platysma muscle. So, in the subcutaneous tissue only of the pectoral, remember there is a muscle which is a platysma muscle. Yes, it is supplied by a nerve which is called as the facial nerve. When the angle of the mouth is pulled down, when this angle of the mouth is pulled down, the muscle contracts and the wrinkles, you can see the wrinkles which are appearing on the skin of the neck. So here it is, when the angle of the mouth is pulled down, there would be because of that there will be contraction of this muscle. There occurs contracts, the muscle contracts and the wrinkles appear on the skin of the neck. This is one, and one more is platysma muscle protects the external jugular vein which is present underneath this muscle from the external pressure. From the external pressure, the external jugular vein is protected by means of this muscle which is present subcutaneously. Yes, you can see this muscle. So this is the platysma muscle which is present just beneath the skin. Subcutaneously it is present. Yes, this is extending about the second intercostal space. It will be extending. So this muscle is called as a platysma muscle because it is intruding into that of the pectoral region. We say the content in the superficial fascia of pectoral region is a muscle which is present subcutaneously, that is platysma. Yes, the last but not the least, the very important structure which is present in the superficial fascia of the pectoral region is the breast, that is a mammary gland, which is a modified sweat gland which is present in the pectoral region, that is in the superficial fascia of the pectoral region. Yes. This is about the superficial fascia. One more thing in the superficial fascia is, when you are studying in the general anatomy, I think you might have come across the dermatomes. What are dermatomes? The area of the skin which is supplied by a segment of the spinal or nerve root is called as a dermatomes. So the sensory distribution of each nerve root, the sensory distribution of each nerve root is called as dermatomes. So when you see, there is a sensory distribution of each nerve root. When you see in the pectoral region, these are the dermatomes that you are seeing it. When you say clinically, why we are saying about the dermatomes? Yes, why? You have to know the dermatomes which are present in the pectoral region, because, for example, there is some viral infection which is called as herpes zoster. So you can see here, some infection is present. When you are seeing it, it is not profusely spread whole through the of the part of the pectoral region. It is present in some places. Yes, you can see it. It is only in areas where the skin, where the spinal nerves. So the dermatome is the area which is supplied by means of a segment. It means the afferent nerves which are supplying that segment is involved in this infection. So when you have to study whether it is because of the any viral infection or because of the something, yes, you need to know the dermatomes of the pectoral region. So to know that of the spread of the herpes zoster or any of that of the compression of the spinal nerve roots or any of the neurological defects, that is radiculopathies, you have to know this dermatomes. Yes. So this ends the superficial fascia of the pectoral region. So when we have the overview of the superficial fascia, what we have done in the superficial fascia of the pectoral region, when you have a quick look into it, so what we have started is in the superficial fascia. First we have told what are the contents of the superficial fascia. The contents of the superficial fascia, when we were saying, it includes the cutaneous nerves, vessels, platysma and the mammary gland. So among it, the fascia consists of moderate amount of fat. Yes, cutaneous nerves which are supplying the pectoral region up to that of the second intercostal space, where the supraclavicular nerves of the cervical plexus, medial, intermediate and lateral. Below it is supplied by the anterior and lateral cutaneous nerves. This is the cutaneous nerve supply of the pectoral region. Coming to the top, the what is pulled away? The intervening nerves, means above it is C3, C4. Below, after the second rib, it is T2 and T3. C5, C6, C7, C8 and T1, the intervening nerves are pulled away, which are supplying to the top, the upper limb. This in deep we will be knowing when we are studying the embryology, that is developmental part. But yes, remember here they are pulled away to supply to the top, the preaxial and postaxial border of the upper limb. Next, coming to the vessels, above the second, it is supplied by that of the it is supplied, means medial, it is supplied by the anterior cutaneous nerves, which is accompanied by the perforating branches of internal thoracic artery. Laterally, it is supplied by the posterior intercostal arteries, which are accompanied by lateral cutaneous nerves. Next, after the cutaneous vessel, the next which is present in the superficial fascia is a muscle, which is the content here. Yes, this muscle is helpful in protection of the external jugular vein from the external pressure. Yes, after it, the modified sweat gland, which is the mammary gland. So this is the content in the superficial fascia of the pectoral region. Yes, this is about the dermatomes. Next, coming to that of the deep fascia. What is present in the deep fascia? The deep fascia is that fascia which is covering the pectoralis major muscle. The pectoralis major muscle is covered by the fascia which is called as the pectoral fascia. Means in the pectoral region, the deep fascia which is present here is called as the pectoral fascia. So when you see the cross-sectional view, this is a pectoral major muscle which is covered by the fascia which is called as a pectoral fascia. When you remove the skin, after the skin we have removed the superficial fascia. After the superficial fascia, we are in the deep fascia. The deep fascia in the pectoral region is called as pectoral fascia. After the pectoral fascia, which is covering the pectoralis major muscle. So just parallel to that of the pectoral fascia and just beneath the pectoralis major muscle, there is a fascia which is present in the deep fascia which is called as clavipectoral fascia. The clavipectoral fascia, the name itself, it is indicating that it extends vertically from the clavicle to that of the axilla. So this fascia which is present parallel to the pectoral fascia and the pectoralis major muscle is called as clavipectoral fascia. So this is a clavipectoral fascia which is a strong sheet of the fascia which is attached above to the clavicle and below it extends up to the axilla and suspended by means of a ligament which is called as suspensory ligament of the axilla. When you see it, the vertical extension of the clavipectoral fascia, the clavipectoral fascia which is extending from the clavicle, yes, it consists of two laminae, anterior and the posterior laminae. The anterior and the posterior laminae, it enclose the muscle which is called as a subclavius muscle, extends downwards as a single laminae, again splits and encloses the pectoralis minor muscle and converges as that of the suspensory ligament of the axilla and supports the dome of the axilla. Means it suspends the top of the axilla, the dome of the axilla, the dome at the concavity of the axilla is made by means of this ligament which is suspending, which is called as suspensory ligament of the axilla. When you see the vertical extension of the clavipectoral fascia which is extending from the clavicle to the axilla, it splits in two. First, at the upper part it splits at the clavicle to enclose subclavius muscle. In the lower part it splits to enclose the pectoralis minor muscle. The posterior lamina which is splitting and enclosing the subclavius muscle extends above to the neck part as an investing layer of deep cervical fascia. There here it is forming one fossa supraclavicular, but that is dealt in the investing layer of deep cervical fascia. But the same thing you do remember here only. Here the posterior lamina which is extending up to the neck is a investing layer. It is forming an investing layer of deep cervical fascia. Here it is forming as a deep cervical fascia. So now here it is splitting, enclosing subclavius muscle, forming as a single laminae, again splitting, enclosing the pectoralis minor muscle, forming as a suspensory ligament of the axilla and it suspends that of the dome of the axilla and forms in a fold which is called as anterior axillary fold. What you have seen in the surface anatomy I have showed there, when there is a two folds, anterior and the posterior. So the anterior axillary fold which is formed by the top, that fold is maintained or the dome is suspended by means of the suspensory ligament of the axilla. This is a vertical extension what you are seeing, the clavipectoral fascia from above clavicle to that of the axilla. But when you see the same fascia extending to that of your medially and laterally, what you see it, when you see the medial and lateral, so this is a clavipectoral fascia. So we have seen the clavipectoral fascia extending from the clavicle above to the top of the axilla below and forms a ligament which is called as suspensory ligament of axilla. But when you see the medial and lateral extension, the clavipectoral fascia, medially it attaches to the top of the intercostal spaces with the intercostal membrane which is present here and up till the top of the second rib and forms a ligament here, what it is called as costoclavicular ligament. Medially it extends and forms a costoclavicular ligament. Laterally, the clavipectoral fascia extends up to the coracoid process. So when you see it, the laterally it is extending up to that of the coracoid process of the scapula. This is a coracoid process of the scapula, attaches to the medial end of the coracoid process of the axilla and forms a ligament which is called as the coracoclavicular ligament. So laterally it forms a ligament which is called as coracoclavicular ligament. Medially it forms a ligament which is called as costoclavicular ligament. Whole of this clavipectoral fascia is pierced by, when you are seeing it, so this is a clavipectoral fascia what we have described which is extending from clavicle above to the axilla. You can see the clavipectoral fascia is pierced by some vascular structures that you can see it. You can see from here the first, from when you see from medial to the lateral side, first is a lateral pectoral nerve. Next what you will be getting is the thoracoacromial vessel which is a branch of second part of the axillary artery, and next is the cephalic vein which drains into the top of the axillary vein. So this is the content of the clavipectoral fascia along with few lymphatics. So the clavipectoral fascia, the content when you see it, it is pierced by From medial to lateral is the lateral pectoral nerve, which is coming from the top of your lateral cord of the brachial plexus. After that is the artery, that is the thoracoacromial artery, which is a branch of axillary artery. Then there is a vein, which is cephalic vein, which is draining into the top of the axillary vein. Along with the content is also few lymphatics are also present, which are piercing the clavipectoral fascia. I want to repeat the clavipectoral fascia once again. When you are seeing, so this is the deep fascia what we are seeing it. The deep fascia is called as, in the pectoral region, is called as pectoral fascia. This is covering the muscle, that is pectoralis major muscle. So this is the pectoral fascia which is covering the pectoral fascia major muscle. Just parallel to the pectoral fascia, vertically from above to below, you see a fascia which is called as clavipectoral fascia. So this is the clavipectoral fascia which is extending from clavicle above to the axilla below. So when you are seeing, this is the fascia which is a deep, this is what you are seeing as a strong sheet of fascia which is extending from clavicle to the top of the axilla. So when you see the vertical extension, the clavipectoral fascia above splits to enclose the subclavius muscle, below it splits to enclose the pectoralis minor muscle, continues downwards as suspensory ligament of the axilla. This is vertical extension. When you see the medial and lateral extension of the clavipectoral fascia, medially the clavipectoral fascia is attached because the intercostal spaces are present here, that is anterior intercostal spaces. When you are seeing, yes, these are the anterior intercostal spaces. So medially it is attaching with that of these intercostal spaces along with that of the second rib, along with that of the first rib, and forms a ligament which is called as costoclavicular ligament. Costo means rib. To the clavicle, they forms a ligament which is called as costoclavicular ligament. The fascia is forming a ligament medially, that is costoclavicular ligament. Laterally, the clavipectoral fascia, it is attached to the coracoid process of the scapula and forming as a ligament which is called as coracoclavicular ligament. Yes, it is forming a ligament which is called as coraco. This is a clavicle, coracoclavicular ligament. Whole of this clavipectoral fascia, what we are seeing is in the upper part, it is pierced by, when you are seeing it, it is pierced by some vascular structure from medial to lateral side. The first one is a lateral pectoral nerve, one that of your lateral cord of the brachial plexus. The second is the axillary artery, the branch of the axillary artery, that is thoracoacromial artery. Then is a vein which is called as cephalic vein, which is draining into axillary vein with the few lymphatics. So this is what the clavipectoral fascia is pierced by nerve, artery, vein along with a few lymphatics. Yes. So this is about the clavipectoral fascia. Yes. The last thing in this competency of 9.1, the muscles of the pectoralis region. The muscle here, up till by now you got to know it. It is pectoralis major, minor muscle, subclavius, serratus anterior. One thing to remember, whenever you are studying about the muscle, what you have to know is, you have to know the origin, you have to know the insertion, action and the nerve supply. Let us see the each thing in detail. First, when you see the pectoralis major muscle. So this is the pectoralis major muscle. When you see it, it is a triangular shaped muscle. We can see the origin is broad, then the insertion is very narrow. When you see the origin, it has a broad origin, and when you see it, the origin, it is also having different origin. Some part of pectoralis major is getting from clavicular part, medial part of the clavicle, some from the anterior row lateral part of the sternum, some is coming from the top of the external aponeurosis, the muscle of the abdomen. So in this way, there are the different origin. The origin is more broad origin when you say that of the Insertion. The insertion is the very narrow insertion you can come to see. So here it is a triangular shaped muscle with a broad origin and the narrow insertion. So when you see it, it consists of two laminae, that is anterior laminae and the posterior laminae are present. The anterior laminae of the pectoralis major muscle includes clavicular fibers, manubrium fibers, the fibers which are coming from the top, the manubrium of the sternum, and some fibers which are coming from the costal cartilages, means sternum, and from the ribs, that is sternocostal fibers. So these three are together forming that of the anterior laminae of the pectoral major muscle. So this includes, so the clavicular fibers are called as superficial fibers, manubrial fibers are called as intermediate fibers, few sternocostal fibers are called as a deep fibers. So these three put together forms the anterior laminae of the pectoralis major muscle. The clavicular fibers take its origin from the medial anterior surface of the clavicle. This is the clavicle. From the medial anterior surface of the clavicle, the clavicular fibers of pectoralis major will be coming. The manubrial fibers taking origin from the manubrium of the sternum. So these are the intermediate fibers which are coming from the manubrium of the sternum. Next, coastal fibers which are coming from the top of the ribs. So from second to sixth rib, so the coastal fibers, but only few fibers are included in the anterior laminae. So these four forms the anterior laminae of the pectoralis major muscle. Now coming to the posterior laminae. The posterior laminae of the pectoralis major muscle, its origin is from the top here external oblique aponeurosis and also from the top fibers of the sternocostal, because here we have included only few fibers. Here the rest of the fibers from second to sixth, lower part of second to sixth, and from the aponeurosis. So these anterior and posterior laminae fibers, both fibers together, they converge and form a U-shaped twist. It forms a twisted manner. The insertion is in the twisted manner in such a way that the lower fibers, means the posterior fibers, come at the higher part and the anterior fibers are coming at the lower part. So to understand this, we say as the anterior and the posterior fibers. When you see it, yes, pectoral major muscle is a triangular muscle with the origin is very broad but the insertion is narrow. That narrow insertion is also U-shaped twisted manner where the posterior lamina is at the highest point and the anterior laminae are the lowest point. Do remember this? So it is in the twisted manner where the posterior fibers are the high and the anterior fibers are at the lower part, and this is forming as the anterior axillary fold. We said it when we are seeing the surface anatomy, there I have showed the axillary fold. Yes, that axillary fold is formed by the posterior fibers of the pectoralis major muscle. So this is forming the anterior axillary fold. Okay, ma'am. But when you see the insertion of pectoralis major is into the intertubercular sulcus, the lateral lip of the intertubercular sulcus between the greater and the lesser tuberosity. There is a intertubercular sulcus is present. For that sulcus also, to the lateral lip of the intertubercular sulcus, the pectoralis major goes and insert. So that narrow insertion where the posterior lamina is at the highest and the anterior fibers are the lower part is inserting into the lateral lip of intertubercular sulcus. When you see intertubercular sulcus at the groove, if you say as a groove, the groove consists of medial lip and the lateral lip. To that lateral lip, the pectoralis major is going and inserting. Yes, so this is a broad sheet muscle. The origin, it has a clavicular origin, sternocostal head is present. All of them are inserted into the lateral lip of the bicipital. When you see the nerve supply of the pectoralis major muscle, so this is the pectoralis major muscle. We have removed the skin, superficial fascia is done. Even the deep fascia, now you knew it, it has been removed. After that, what you are seeing, this muscle is the pectoralis major muscle, consists of clavicular head, This is that of your sternal origin of the pectoralis. From the lower down part, you get the external oblique aponeurosis, from where the pectoralis major coming and inserting into the lateral lip of the intertubercular sulcus. When you see the nerve supply of the pectoralis major muscle, so this is a major and this is a minor muscle. To see the nerve supply, you have to flip, means you have to cut the pectoralis major, because you can see the nerve supply is, the pectoralis major is supplied from the lateral pectoral nerve and the medial pectoral nerve. You can see the medial pectoral nerve is piercing the pectoralis minor and then supplying to the pectoralis major muscle. So this is pectoralis major muscle which is supplied by medial and lateral pectoral nerve. This is the nerve supply of the pectoralis major muscle. When you see the action of the muscle, what does this action of the pectoralis major is done? The pectoralis major is helpful for whole of the muscle. He is helpful for medial rotation of the humerus, medial rotation and adduction of the humerus. Medial rotation and the adduction of the humerus is by that of the pectoral major muscle. Next, the clavicular head of the pectoralis major, he is helpful for the flexion of the humerus. The flexion is by means of the clavicular head of the pectoralis major muscle. So the major action is flexion of the humerus, adduction of the humerus and medial rotation of the humerus is done by means of pectoralis major, clavicular head and that of the costal fibers are responsible for this action of the pectoralis major muscle. So we have seen the origin, we have seen the insertion, we have seen the action of pectoralis major muscle. Yes, we have seen the nerve supply of the pectoralis major muscle. So each muscle you have to know all these things: origin, action, nerve supply and insertion. Let's follow the pectoralis minor muscle. The pectoralis minor muscle is also the triangular shaped muscle, but not so broad. But you can see the origin of pectoralis minor is coming from that of your ribs, 3rd, 4th and 5th ribs. Not that of the cartilage part, only from the ribs, costal origin only. It is not from that of the cartilage, it is only from the ribs, from 3rd, 4th and 5th ribs. It is taking its origin, inserting into the medial aspect of the coracoid process of the scapula. You can see it is inserting into the medial aspect of the coracoid process of the scapula. The origin is from the only ribs, that is 3rd, 4th and 5th costal ribs, and inserting into the coracoid process, medial aspect of the medial border, inner surface of the coracoid process of the scapula. Yes, nerve supply, already you knew it. It is by means of medial pectoral nerve. Already we have said the medial pectoral nerve, it is piercing the pectoralis minor muscle, then supplying to that of the pectoralis major muscle. Whenever you want to identify the pectoralis minor muscle in dissection, when you are seeing it, the upper border of pectoralis minor, you can see the lateral pectoral nerve, which is a content in the clavipectoral fascia. If by now you can know it, here when we are describing the clavipectoral fascia, from medial to lateral side, we said lateral pectoral nerve, thoracoacromial vessel, cephalic vein. Yes, the lateral pectoral nerve is present in the upper border of pectoralis minor muscle. When you see the lower border, here it is the pectoralis major muscle, you get to the lateral thoracic vessel will be coming at the lower border. When you are seeing here, you will be getting the thoracic vessel, but at the upper border, you come to see the lateral pectoral nerve. Yes. So this is about the pectoralis minor muscle. Now coming to the action. The action of pectoralis minor muscle is along with the serratus anterior. So because serratus anterior, along with serratus, there is one more muscle which is called as serratus anterior. Next we will be seeing it. Along with it, the pectoralis minor is responsible for protraction of the scapula and depression of the scapula. Protraction means when you are doing in this way, it is called as protraction. Your scapula is protracted, so it is responsible for protraction of the scapula, and also for the depression of your scapula is by means of pectoralis minor muscle. So minor is responsible for protraction and retraction. When you see the major, it is helpful for flexion, extension at the shoulder joint, joint along with the adduction of the humerus is by means of pectoralis major muscle. But when you see the minor, it is totally different. It is doing protraction of the scapula and depression of the scapula is done by means of pectoralis minor muscle, because it is inserting at the coracoid. If you ask me why, the insertion is at the coracoid process of the scapula. Because of this, it is helpful for protraction and depression. Yes. The one more muscle next to it is subclavius muscle. The name itself, it is below the clavicle. This is muscle is present. The subclavius muscle takes its origin from the first rib. It starts its origin from the first rib and inserted into the groove which is present in the 1/3 of the inferior surface of the clavicle. This is the clavicle. Within that of your inferior surface, the middle 1/3 of the inferior surface of the clavicle, there is a groove of the subclavius. When you said done the osteology part, you might have known there. So, subclavius which is coming from the first rib, from the first costal cartilage, it is getting inserted into the groove for the subclavius which is present on the 1/3 part of the inferior surface of the clavicle. So, origin is from the first rib to that of the groove for that of the subclavius. That is the insertion of that of the subclavius muscle starting from the first rib, insertion into the groove. When you see the action, yes, the action of the subclavius muscle is it depresses the clavicle and it is helpful for maintaining the clavicle in that position. When you see the shoulder joint is away from, yes, it is not coming in nearer, it is away. That it is maintained by means of the clavicle which is present here. So that clavicle is maintained in that horizontal position, means the steadiness of the clavicle is because of the subclavius muscle which is present below. So the main action of the subclavius is making the clavicle in that position, that horizontal position what it is doing, and it is also helpful for the movement of the shoulder girdle. So this is the action of the subclavius. Yes, the nerve supply of the subclavius is from the upper trunk. The upper trunk gives branch which is called as Erb's point. So when you are seeing the brachial plexus, you come across here from the trunk. It is nerve to subclavius is the nerve supply for that of the subclavius muscle. So subclavius is supplied by nerve to subclavius which is coming from the upper trunk of the brachial plexus. When you see the action is maintaining the position of the clavicle and it is helpful for the movement of the shoulder, that is shoulder girdle movements is maintained by means of the subclavius muscle. Yes, this is what the subclavius muscle coming from that of the first rib. Yes, inserting into the medial 1/3 of the groove which is present within that of the clavicle, subclavian groove. The nerve supply is by means of the upper trunk, that is that of the subclavius. Nerve to subclavius is supplying to the subclavius muscle. Yes. The last muscle is serratus anterior muscle. The origin of serratus anterior muscle is from the outer surface of the 8 ribs, upper 8 ribs. There are 12 ribs, 12 pairs of ribs on either side. From upper ribs, outer surface of the upper 8 ribs, the serratus anterior is taking origin, inserting into the medial, that is the costal side, medial border of the scapula. When you see it here, yes, it is coming, the origin you can see from the outer surface of the upper 8 ribs it is coming, along with that of your membrane, that is the intercostal membrane will be present here. Along with this one, the serratus anterior is taking its origin from the outer surface of the upper 8 ribs and inserting into, when you see its insertion, it is inserting to the medial border. If you remember, this is a lateral border of the scapula, this is a medial border of the scapula. So it is inserting into the medial border of the scapula, that is a costal aspect. When you see, if you remember, scapula surfaces as costal and the dorsal. So at the costal surface medial border, it is going and inserting. When you see the insertion, when you see the first digitation of the serratus anterior is inserting to the superior angle of the scapula. Second, third and fourth digitation is inserting into the medial border of the scapula. The rest of the serratus anterior digitations are inserting into the of your inferior angle of the scapula. Because of that nature, serratus, it is called as serratus anterior. First to that of the superior angle, second, third and fourth to the medial border, rest 4 or 3 is inserted into that of the inferior angle of the scapula. So this is the insertion. Do remember 8 digitation. It is coming from 8 ribs. So 8 digitations are there present. You have to remember that. The first digitation to the superior angle. Second and third along with sometimes fourth to the medial border. The rest 4 are inserted to the inferior angle of the scapula. So that is the insertion of the serratus anterior muscle. When you see the nerve supply of the serratus, it is supplied by the long thoracic nerve which is coming from the roots of the brachial plexus C5, C6 and C7. When you say here C5, C6, C7, that is long thoracic nerve. C5 and C6 supplying to first 2 digitation. C6 is supplying to next 2 and the rest are supplied by the C7 digitations. So by C5, C6 and C7, that is long thoracic nerve which is also called as nerve of Bell. So this is the nerve supply of serratus anterior muscle. Yes. Earlier only we have got to know the action of serratus anterior. It is along with aided with the pectoralis major muscle. It is helpful for protraction of the scapula. If that is paralyzed, if serratus anterior muscle, that is long thoracic nerve, is what is be happening? Yes, there will be winging of scapula because this is going and attaching to the medial border of the scapula. So you can see the winging of the scapula. That attachment is lost. What will happen is the scapula will be winged outward. So this is called as winging of the scapula. If there is any injury to the long thoracic or the nerve of the bell, yes, it is also helpful for pushing and the punching action also. The serratus anterior is responsible for even that actions also, that is nerve of bell. If it is paralyzed, what happens is it is the winging of scapula. So this is what you see as a winging of the scapula. Yes. Some places have told the clinical, but all in all, what is the clinical significance of the pectoralis? Tear of this muscle, pectoral region muscle, major or minor, is very rare unless in some few athletes or a sports person who are in high contact sports or power lifters. Only in those there might be the tear of the muscle can happen, but it is a very rare condition. One more condition that you have to know here is Poland syndrome. What is this? It is a congenital anomaly where there is deficiency of pectoralis major muscle. So one side of the body, the pectoralis major has not been developed, other side it is present. If it is absent, what are the manifestation? What you can see it is, you can see the shortening of the fingers. The fingers are very short. Syndactyl, you can see it. Or hypoplasia of the hand. The hand is not formed fully. That is called as hypoplasia of the hand. So these 3 features together forms a syndrome which is called as a Poland syndrome. Very rarely, which is a congenital anomaly. It is due to the deficiency of pectoralis major muscle. These are the few clinical significance. Yes, this is the end of the class. Yes, any doubts? You can ask. Thank you. Good day.